see a CT trauma setup, which is really a general setup plus a couple simple things. A triple transducer and infusions. A triple transducer involves an arterial line, a line to connect to the PA catheter potentially, and a central line transducer. This transducer setup can either be done with one pressure bag and 500 cc bag or two. For a triple transducer with one bag and 500 cc normal saline bag, you need another pressure tubing line. The way I remember this is that you ultimately need 3 lines that are going to be providing information to the monitors. And you have one less thing to spike. Grabbing the Y piece from the perfusion room, disconnect the portion that would be connected to the 500 cc bag and discard this. Disconnect the central line kit from the tubing that's connected to the 500 cc bag. Connect it to one end of the Y piece, and the other two will be connected to the PA and the central line, like so. So this is the final completion of a triple transducer. The CVP and PA sharing the Y piece, as you can see, and the arterial line. These are the drugs you need for a cardiac setup. Starting from the beginning: atropine, lidocaine, succinylcholine, rocuronium, pancuronium, ephedrine, phenylephrine, epinephrine at 4 mics per cc, nitroglycerin, calcium chloride, midazolam, sufentanil usually, propofol or etomidate, heparin, antibiotic, either Kefzol or vancomycin usually, Amicar, and protamine. Protamine must be administered through a device called Baratrol, and it helps this medication infuse slowly so the side effects are diminished. The Baratrol is attached to a 250 cc bag and then administered to the patient. These are the cardiac infusions that you would be required to make for a cardiac trauma room or for a cardiac case. The first infusion is nitroglycerin. It's a 100 milligram bottle of nitroglycerin in a 250 cc bottle, 400 mics per cc. That's the first infusion. Attached to a Sigma pump, run at 0.5 mics per kilo per minute. Currently, it's set to a weight of 70 kilos. The second infusion is an epinephrine bag infusion. It's from one of these vials, 1 milligram per cc of epinephrine in a 250 cc normal saline bag. This makes a 4 mic per cc infusion of epinephrine. This infusion is usually set at 0.03 mics per kilo per minute, set at a standard dose of 70 kilos adjusted to your patient. And the third infusion is usually a sufentamidaz infusion. The sufenta is usually 250 mics of sufenta and 5 milligrams of midaz in one of these 250 cc normal saline bag. It's set to sufenta rate of 1 mic per kilo per minute and spiked and primed. Since these are narcotics, we haven't spiked them for this case. And finally, all of these infusions are attached to an LR bag with a microdrip. Don't let this surprise you or make you nervous. This is actually quite easy. You just have 4 stapcocks attached to the end of this microdrip with nitroglycerin closest to the infusion port, epinephrine, and sufentamidaz on the third, each distinctly and accurately labeled. Besides cardiac infusions, you'll also have to make cardiac fluids for a cardiac room. This involves a regular normal saline bag on a fluid warmer set. It also involves an LR bag on a macro drip. And what's unique about a cardiac trauma / cardiac setup is the cardiac output bag, which is attached to the Swan. It's a 500 cc normal saline bag with a macro drip, and at the very end, 2 stopcocks with the flush, or a regular 10 cc syringe.